Then it is not our correspondent John Kasim who is joining us, but Kensington Marufu, an HIV/AIDS activist and lawyer. Kensington, good afternoon, and thank you for joining us on Africa Update.
Afternoon. Thank you for having me.
Kensington, what is the situation on the ground regarding Zimbabweans living with HIV who are unable to access treatment? And before you respond to that, maybe let's start with what were the reasons for the breakdown in communication or negotiations between the Zimbabwe and the United States with regards to the U.S. funding HIV and other health services in the country?
Okay, thank you so much. The the government of Zimbabwe declined to have the assistance from the United States government on the issues to do with the funding HIV on HIV/AIDS related issues due to the terms of references that were involved in the deal, in the agreement.
Now, tell us about the situation on the ground in Zimbabwe regarding to people living with HIV who are unable to access treatment.
Okay, on that issue, it's all about continuity of care. The recent increase in migration from the people coming from South Africa who were in treatment on treatment in South Africa is expanding the needs for the current health system here in Zimbabwe. Though we have made much progress as a nation on issues to do with HIV in our country. The increase in the sudden movements of people has affected the strain on the current number and budgets of people who are relying on ARVs. Then also on the issues of the individuals concerned, the issue of continuity of care. Some of those people may have left their medication outside Zimbabwe, so this is really affecting their well-being and their health due to lack of adherence to ARV treatment.
And what about their families? What is the impact on people who've returned to the country and now their families are now seeing and experiencing what they're now going through?
Okay, having lived and worked in South Africa for a long time and having been detached from the family setup is a challenge on itself. So people who are coming to Zimbabwe to reconnect with their family after having detached from them for quite some time, it's actually a challenge itself. The issue of reconnecting uh, and merging into the communities that are already on the ground here. This is greatly affecting the adherence on the continuity of treatment. As some of these people will be shy to access medical services amongst those people whom they know.
Why are so many Zimbabweans, Zimbabwean nationals who relied on South Africa's public health system for HIV treatment, what is happening now in Zimbabwe? You mentioned the fact that it is becoming a challenge, and what is government doing to assist these individuals, especially with the fact that if there is interruption in the continued taking of medication, that just creates an even bigger challenge.
Okay, the government of Zimbabwe itself has made greatest strides on combating HIV. So the government is prepared for hosting its returning citizen. But the issue that is at hand currently is that some of these people are themselves are unwilling or reluctant to look for services or to seek medical services due to one accessing medical facilities in the country, having been away from the country and feeling so isolated from the communities that they are living in. itself is discouraging some of the people to speak up about HIV and AIDS or to seek services.
Clearly, stigma is now becoming an even bigger challenge, as you say, the reintegration into the community and their families. Are they getting assistance with regards to just the psychological impact of what this may do if they do not continue taking medication?
Yeah, the systems are in place. The National AIDS Council and the Ministry of Health in Zimbabwe, yeah, they are actually prepared for these kind of issues. But accessing that information, having been isolated from the country itself, may be a challenge to those people who are returning from South Africa.
Kensington, thank you so much for joining us. We are going to leave it there for today.
Okay, thank you so much for having me.
It's been a pleasure. That's Kensington Marufu, an HIV/AIDS activist and lawyer, joining us on the line.
Darubini ya Afrika na I am Henry.